Good day everyone, my name is Tisha Meherali from BSN 212G, and today I'll be performing the parenteral medications, which includes intradermal, subcutaneous, and intramuscular injections. So before we begin, I will now check the doctor's order and the MAR for the verification of the drug that we're going to be using later. Now I'll be preparing the equipments to be needed, and I will perform hand washing and meet the patient. Now let's start the preparation of the vial. Now let's start with the hand washing. And now I will prepare the vial, which is this one. And I will be mixing it with the sterile water. And I'll be showing you how to do it. So first, you wanted to remove the rubber cup, this part, and then you wanted to grab a alcohol swab, and then you wanted to clean the center of the sterile water and discard it. And then after that, you wanted to grab your syringe and you get so you open the syringe and then you remove the regular syringe because we'll be using a filter needle. And we'll be opening this filter needle, which the gauge can be 25 to 27. Now, you wanted to push the filter needle so that it is secure. Then after that, you wanted to remove the cap. And then, you will inject air with a prescribed amount. For this dose, I will be injecting 0.3. Making sure that you're injecting in the center in a 90-degree angle. Inject the air and invert the vial and administer 0.3 or withdraw 0.3. Now remove this. Flick because there are bubbles visible. And now you want it to release some medication. Okay? And that will be your sterile water. I will be mixing the sterile water to our vial. And first, you want to remove the cup by flicking it off. Like that. And again, you wanted to grab an alcohol swab and you clean the center of the vial. Then you want to grab your filter needle or the syringe, and then you want to inject the sterile water to the vial. So let's spray and inject, remove, and then going to mix the solution. And then placing it on a flat surface. And then you wanted to put your syringe into the filter needle as tightly as you can. And then after that, you wanted to remove the cup from the needle and then draw or inject some air. Eject some air to equal to the volume that you're going to withdraw. So I'll be injecting 0.3 of air and then making sure that the bevel is up. I'll be injecting in the center and then inserting the air and hold my vial up or invert my vial, and then I'll be withdrawing 0.3. I'll be flicking the bubbles and then I'll be getting out. Okay. And then after that, you wanted to recap it. Remove the filter needle. And you wanted to change it into the regular syringe. Back to the regular syringe. As tightly as you can. Then set that aside because we will be using that later for the parenteral medications. Now let's proceed to the preparation of the ampule. First, you wanted to proceed with the hand washing. And after that, you wanted to get your ampule, making sure that it has a score on it. And then, you wanted to flick the upper stem of the ampule so that the liquid will go to the base of the ampule. You will get your ampule opener, but for this video, I will be using the 4x4 gauze or a gauze. And then, I will be putting it around the upper stem of the ampule, making sure that I'll be bending it towards me so that the broken particles will be away from me and from others. And with this broken piece, I will be putting this and disposing it on the sharps container. And it is ready for withdrawal. So, for this one, I wanted to place it on a flat surface to prevent spilling of the medication. And I will be grabbing my syringe and I will be changing the syringe with the filter needle. Making sure that it is attached. Okay, so after that, you wanted to remove the cap of your filter needle. And then making sure that the bevel is up. For this one, you don't need to inject air when administering ampules. So what you want to do is put the bevel on the center of the medication And your non-dominant hand can be on the base of the ampule, supporting it. Then I'll be aspirating, I'll be withdrawing the medication, making sure that it is in the correct medication. You flick the air bubbles, and we're gonna inject. Okay, so the order is 0.5. There it is. You wanted to inject that bubble. And then after you get the desired amount, you wanted to recap yours. So after you get the prescribed amount, you wanted to recap the filter needle, and then you want this to place on the side. Now we will be changing the filter needle with the regular syringe, because we will be using this later for the parenteral medication. Making sure that it is pushed tightly and it is secure. Set that aside, and that is for the preparation of the ampule. Good day, ma'am. My name is Tisha Meherali, your student nurse for today. For verification po, may I see your wristband? Please state your full name and your birthday. How would you like me to call you po? Okay, so Miss Cassie, I'll be administering your medication through parental routes, but before that, I will close the drapes for privacy. I already prepared your medication earlier, ma'am, and the syringes to be used, together with the medication card, so that we can verify if it is the correct medication po and given to the correct patient. So are you ready, ma'am? Okay. Miss Cassie, first we will start with your intradermal injection, and this will create a bleb or a small wheal, but you don't have to worry about that because it is completely normal. So now I will be wearing my gloves. Okay, so Ma'am Cassie, I will now inspect the area that I will be using, which is your forearm. So I don't see any lesions or bruisings, and no tenderness is found. So I'll be using that as my injection site. So I'll be getting my medical swab, and I'll be cleansing the area in a circular outward motion. Be disposing that, and now I'll be getting a dry cotton ball and place it between my fingers, and now I'll be getting the syringe to be used. So I will be removing the needle, or the cap of the needle, and making sure that the bevel is upright for making the easy entry for your injection site later, ma'am. So now I'll be holding it like this so that it is easier for the entry. Okay? So I want to stretch the skin. So since this is an intradermal injection, I will be stretching your skin and making sure that we are going to create a bleb later. Okay? Then I will be putting this on the sharps container, and I will be disposing the cotton ball. I will be putting a mark on it, ma'am, for easier monitoring later. So now, I want you to not erase the marking that I just did, ma'am, so that I can easily monitor for documentation later po. Okay? So now, I'll be removing my gloves. Now through it. And now we are done with our intradermal injection, ma'am. So, I'll be right back in a few minutes for your next medication. And now I'll be documenting. Okay, so Miss Cassie, your next medication will be given subcutaneously, and it is called heparin. So your doctor ordered the 7,000 units of heparin, and we have an available of 10,000 units per ml. So I'll be giving you 0.7 ml of the administration or the medication. So now, this is a anticoagulant injection, and this is to reduce the ability of the blood clotting. So the side effects are irritation, pain, redness, and itching. So I'll be doing my gloves. So now that I've done with my gloves, I will now inspect your injection site, ma'am, which is on your abdomen. So I will be identifying any skin lesions or bruising on that area. So there are no skin lesions or bruising found, and I will be palpating your abdomen, ma'am, for any tenderness. Okay, so there is no tenderness found. We'll be using this injection site, ma'am. So I'll now grab the alcohol swab and cleanse it in the circular motion, outward circular motion. And now I'll be getting the syringe, and I'll be removing the cup, making sure that the bevel is pointing out upward so that it will have an easier access to your abdomen later, ma'am. Okay? So now I'll be making sure. Okay. So now I'll pinch your abdomen, ma'am, and I will put it or hold it like a dart and put it in a 45-degree angle. Now I'll be injecting the medication, ma'am. Now, I will be applying pressure with the cotton ball, and I'll be disposing the syringe in the sharps container, and I will now tape or secure it with the tape. I will secure the cotton ball with the tape. Now we are done with your subcutaneous injection po. I will now remove my gloves. And perform hand washing. And now I'll be documenting the procedure. Now let's proceed to your intramuscular medication. So upon inspecting the injection site, your ventrogluteal or the right hip is the ideal for injection site since it has more muscle mass. So now I'll be inspecting it for any lesions or bruising or tenderness. Okay, so now I'll be palpating for any tenderness. Okay, so no tenderness is found. So now I'll be assisting you in a side-lying position, ma'am, so that I can have a better view of the injection site. Okay? So now I'll be getting my alcohol swab and disinfect the injection site. So I'll be placing my hand onto the injection site, ma'am. So the heel of my hand in the surface, and then my middle finger and my index finger is forming a triangle, and in between that will be my injection site. Okay, so now I'll be getting the syringe, making sure that the bevel is up. Okay, and again, this is an intramuscular injection, so I'll be holding it like a dart in a 90-degree angle. Okay, so I'll be injecting now, ma'am. And I'll be administering the medication. So I'll be putting the button to apply pressure, and I will be disposing this syringe in the sharps container. And I will continue applying pressure on the site, and I will secure the cotton with the tape. Okay, ma'am, we are done. I'll be assisting you back in a comfortable position, which is in your back. Okay. So now, Ma'am Cassie, I'll be documenting the procedure that we have done, and before that, I will be removing my gloves. And perform hand washing, and now I'll be documenting it. I'll be documenting the route, the drug name, the time, and the client's reaction. So Miss Cassie, thank you so much for your cooperation and your patience with me today. If you need anything else, don't hesitate to call me. Okay? So thank you so much once again.